Dengue and severe dengue. Welcome to our journey through the world of infectious diseases. In this spotlight, we'll delve into the dynamics of dengue, the tiny culprit that packs a punch. From its transmission to the battle against severe cases, let's unravel the mysteries together. Dengue. Global burden. Dengue incidence has dramatically increased worldwide. Reported cases to WHO rose from 505,430 in 2000 to 5.2 million in 2019. Actual numbers likely underreported due to asymptomatic cases and misdiagnosis. 2023 saw the highest number of cases globally. Over 6.5 million cases and 7,300 deaths reported. Factors contributing to spread: changing vector distribution, El Niño effects, climate change, fragile health systems, and population movements. Endemic in over 100 countries across WHO regions. Asia bears 70% of the global disease burden. Dengue infection. Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. Nearly half of the world's population is at risk of dengue, with an estimated 100 to 400 million infections occurring annually. Dengue is prevalent in tropical and subtropical regions worldwide, primarily in urban and semi-urban areas. While many dengue infections are asymptomatic or cause only mild illness, the virus can sometimes lead to severe cases and even death. The prevention and control of dengue rely on vector control, as there is no specific treatment for dengue or severe dengue. Early detection and timely access to appropriate medical care significantly reduce the fatality rates of severe dengue. Dengue virus structure. The dengue virus is a positive-sense single-stranded RNA virus, belonging to the family Flaviviridae and the genus Flavivirus. It has 4 recognized serotypes, DENV1-4, based on variations in surface structures, with a 5th serotype being discovered in 2013. Dengue virus cycle in human and mosquito. An Aedes aegypti mosquito can become infected by feeding on a viremic person. During the extrinsic phase, dengue viruses first infect the mosquito's midgut cells and other tissues before spreading to the salivary glands. Infected mosquitoes can then transmit the virus to multiple humans during feeding. After infection, it typically takes 4 to 7 days for a person to show symptoms and become capable of transmitting the virus to new mosquitoes. Both symptomatic and asymptomatic individuals can transmit dengue virus to mosquitoes. Transmission. Transmission occur in many ways. Dengue virus transmitted by infected female mosquitoes, primarily Aedes aegypti. Aedes albopictus, tiger mosquito, also implicated, seen in Europe in 2023. Extrinsic incubation period, EIP, from mosquito ingestion to transmission. 8 to 12 days at 25 to 28 degrees Celsius ambient temperature. Influenced by factors like daily temperature fluctuations and virus genotype. Human to mosquito transmission. Mosquitoes become infected by viremic individuals, symptomatic, pre-symptomatic, or asymptomatic. Transmission occurs up to 2 days before symptoms and up to 2 days after fever resolution. Risk associated with high viremia and fever. DENV-specific antibodies reduce risk. Viremia typically lasts 4 to 5 days, up to 12 days. Maternal transmission. Maternal transmission are rare but possible from pregnant mother to baby. Vertical transmission rates low. Timing during pregnancy matters. Associated risks: preterm birth, low birth weight, fetal distress. Other transmission modes: rare cases via blood products, organ donation, and transfusions. Transavarial transmission within mosquitoes. Dengue and severe dengue. The dengue virus can affect humans in 2 ways: as a primary infection, dengue fever, or as a secondary infection, dengue hemorrhagic fever and dengue shock syndrome. Secondary infection occurs in those previously infected with one of the 5 serotypes. Dengue fever is suspected when a high fever, 40 degrees Celsius per 104 degrees Fahrenheit, is accompanied by at least 2 symptoms, such as neuralgia, retroorbital pain, myalgia, arthralgia, nausea, vomiting, rash, or swollen glands. Severe dengue, dengue hemorrhagic fever, is marked by a sudden temperature drop to 38 degrees Celsius 100 degrees Fahrenheit after 3 to 7 days, followed by severe symptoms like abdominal pain, persistent vomiting, hyperventilation, gingival bleeding, fatigue, anxiety, and hematemesis. DHF can be fatal due to complications like plasma leakage, fluid accumulation, respiratory distress, hemorrhages, and organ impairment. Mortality rates can exceed 20% if untreated, but with proper care, they can be reduced to less than 1%. Dengue infection. Overview. Dengue, also known as breakbone fever, is a viral infection transmitted by mosquitoes. Common in tropical and subtropical climates. Most cases are asymptomatic, but some individuals experience symptoms. Common symptoms are high fever, 40 degrees Celsius or 104 degrees Fahrenheit, severe headache, pain behind the eyes, muscle and joint pains, nausea and vomiting, swollen glands and rash. Severe dengue or dengue hemorrhagic fever. Rare but serious. Symptoms may appear after the initial fever subsides. Symptoms are severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue and restlessness, blood and vomit or stool, thirst, pale cold skin and weakness. Risk factors. Risk factors are previous DENV infection increases severe dengue risk. Urbanization, unplanned, affects transmission. Population density, human mobility, water storage practices. Laboratory diagnosis of dengue. Acute phase diagnosis, 0 to 7 days after symptom onset. During this acute phase diagnosis time, NS1 ELISA and IgM tests or NAAT, that is nucleic acid amplification test, and IgM tests are done. Convalescent phase testing after 7 days post-symptom onset. During this phase, IgM ELISA is the primary test. NAAT or NS1 ELISA might still be positive. IgM antibodies detectable for 3 months or longer. Prevention and control. Prevention and controlled measures are mosquito protection and mosquito breeding prevention. Mosquito protection. Wear protective clothing. Use mosquito nets, sprayed with repellent, during daytime sleep. Install window screens. Apply repellents, DEET, picaridin, IR3535. Use coils and vaporizers. Mosquito breeding prevention. Manage and modify egg-laying habitats. Properly dispose of solid waste. Remove artificial water-holding containers. Apply insecticides to outdoor water storage. Treatment and vaccination. Treatment. Rest and hydrate. Use acetaminophen, paracetamol, for pain. Avoid non-steroidal anti-inflammatory drugs, ibuprofen, aspirin. Watch for severe symptoms. If the symptoms are severe, seek medical help promptly. Vaccination. Currently Dengue vaccine approved, age 6 to 16 years, high transmission settings. Additional vaccines under evaluation. Dengue is a viral infection transmitted by mosquitoes. It affects millions of people globally, especially in tropical and urban areas. While many cases are mild, severe forms can be life-threatening. Prevention focuses on controlling mosquito vectors, as there is no specific treatment for dengue. Stay informed and protect yourself. Subscribe to Simply Micromed. If you're curious about medical microbiology, infectious diseases, and unraveling the mysteries of tiny organisms, hit that subscribe button. Join our community of science enthusiasts, and let's explore the microscopic world together. Remember, knowledge is contagious. Spread it by liking and subscribing. Thank you.